Hey there, Dr. Luke here, and what we're going to do today is go through a functional range conditioning class for the knee in internal and external rotation, PAILs and rails. So all you're going to need is a yoga block for this, and you're also going to need a chair and to set yourself up near a wall or a door frame. So let's get started. First of all, we want to do knee CARs. Okay, knee CARs, what we're going to do is lie on our back. I use a yoga block to rest my head. And we're going to do our knee CARs on the right leg here, bringing your leg up into this position. This is trying to get that hip rotation out of it. And then we start off with external rotation to the right. And we make a circle. Really focus, moving only your knee in that external rotation, internal rotation movement. We don't want the ankle to come along for the ride. Concentrate on your hamstrings, pulling the knee around. I sometimes like to hold up here so that I can encourage that movement and that contraction. Okay, we're going to hold here, go the opposite way. Slow and controlled, focusing on that internal, external rotation. And last one, try and do 6 reps to one side and 6 reps to the other side. Fantastic. Okay, let's start off external rotation stretch of the knee. We want to get into this base here. What we're going to do is use a door frame or wall, using your yoga block to create a nice cushion for your PAILs and rails contractions. We're going to get in our gentle stretch by moving the chair around and getting ourselves up into our external rotation stretch there. Now, I'm just feeling right there, just a little bit of tension through my joint capsule on this medial side. So that's all I need. I don't want to overdo this one. The knee can be quite sensitive, especially if you've got degenerative changes. So we want to start off with just light tension through that joint capsule. So stand up, start our timer for 2 minutes, and just breathing in and irradiate, and just keep that tension in that knee. Internal and external rotation are the range of motions that we start to lose and we start to get degenerative changes to the knee. So it's really important that we focus on this if we're having knee problems or if you don't have much capacity in your internal external rotation. Consistency is the key for this one. We want to be doing this every day to put those forces through those tissues and to create good adaptation and good responses to those tissues to training. Okay, we're going to be coming up to 2 minutes. My first contraction is going to be pushing into the blocks. We're going to go into internal rotation, contracting the best effort, but a safe contraction. These contractions that we do need to feel safe, they need to feel strong, but we need to build up the intensity to be best effort over time. If you have an injury to the knee or degenerative changes, the intensity may be about 30%. When you're doing low intensity, then you can increase the time of the contractions. Today, we're just going to do 15 seconds, and I'll be counting you in. 5 seconds. 3, 2, 1, contract. So we're contracting into internal rotation. I'm trying to bring my knee around into that internal rotation, building up to best effort. Keep going, keep going. 3, 2, 1, opposite contraction. So what we're doing is we're going into external rotation. We're trying to pull away from that block, going into external rotation, contracting the muscles to do this type of movement. 3, 2, 1, and relax. Okay, now we're just going to recovery mode. We're just feeling that stretch in that knee now, making sure that we're sitting up straight, and we just let things go and finding that stretch. You can move around if you need to find more of a stretch. And this is a 45-second recovery mode. Okay, so building up the next 5 seconds. 5, 4, 3, 2, 1, contract. We're going into internal rotation, contracting the knee, pushing into that yoga block. Best effort, safe contraction. 3, 2, 1, opposite contraction. We're going into external rotation here, pulling away from the block. Three, 2, 1, and relax. Okay, now we go 45 seconds recovery mode. And we can do a few sets of this. And certainly if we've got problems with our knee, we want to be doing longer contractions. If we're working at 20, 30%, we want to be doing 30 seconds to 40 seconds contraction at 30% intensity. Great, just coming up to our 45 seconds. And now we want to slowly come out of that base. And as we're doing that, let's do some capsular CARs. So we're just going to internal, external rotation, focusing that movement just at that knee. Just a few sets there. Fantastic. Let's go now to our internal rotation base. That will be opposite to this. We've got to set ourselves up on a wall again. All right. So I've got my knee in internal rotation there. I'm feeling the stretch through that joint capsule just gently. It's not a huge stretch, but that's all I want. Let's go for a 2-minute stretch here. Excellent. I like using shoes doing this because it helps kind of stick to the floor when you're doing the contractions. I find in bare feet or socks, if you have slippery floors, it just doesn't work as well. So try and have shoes on, a rubber sole, so that you can have some grip as you're pushing and contracting into the isometric contractions. And feeling the tension just through my joint capsule there, which is great. Coming up to 1 minute, so this is a 2-minute stretch. Our PAILs contraction, I'm going to be pushing into the block, and I'm going to be bringing my knee into external rotation, so using all the muscles to externally rotate my knee. My rails contraction is going to more into internal rotation, So I'm going to be using all the muscles to pull away from that block and push my heel into the block, creating that internal rotation. So isometric contraction there. Great, just let things relax. Maybe you have a little bit more tension through the ankle. Try and focus that tension through your knee rather than the ankle, because you are stretching the ankle as well, but we want most of the tension to occur at that knee, and you may have to move around a little bit just so that you're feeling a slight tension through that knee capsule. Okay, 5 seconds and we're going to be going into our PAILs contraction. 3, 2, 1, and contract into external rotation. Really push as hard as you can, building up to the safest and best effort contraction. Keep going, keep going. 3, 2, 1, reverse. We're going to internal rotation. Really contracting the hamstrings, going into internal rotation. Keep going, keep going. 3, 2, 1, and relax, and recovery mode. We're going to find that stretch again. You may need to move yourself around with your chair, or just move in the chair to get that tension where you need it. Fantastic. So 45-second recovery mode. Feeling that gentle stretch. Coming up to another set of PAILs and rails. So 5 seconds. 3, 2, 1, contract, go into external rotation. Push really hard here. Earn these good functioning joints by going into high intensity if you can. 3, 2, 1, and opposite contraction, going to more internal rotation. We're trying to go into that. Contract. Keep going, keep going. 3, 2, 1, and slowly release into recovery mode. And finding that stretch, another 45-second stretch here. Great, just position yourself so you can feel that stretch. Really important not to overdo it in this knee, especially if we do have a lot of wear and tear or an injury of the knee. You just want a light stretch, or just to where your active range of motion is, and just slightly into your passive range. Okay, coming up to our 45-second stretch, slowly coming out of this. And now let's go into our capsular CARs. So we want to externally rotate, internally rotate, externally rotate, internally rotate. Let's do 10 reps of internally and externally rotating, focusing that movement on the knee, keeping the ankle out of it. Okay, another 2 reps. Last rep, what I want you to do is stay in external rotation. Keep contracting in external rotation. Really push that contraction. 15 seconds. 5, 4, 3, 2, 1, and go to internal rotation. Contract. Fifteen seconds here. Keep squeezing that internal rotation. 3, 2, 1, and relax, slowly coming out of that base. And now let's do our knee CARs. In the chair, We're going to bring our knee up into this position. This is to get the hip out of this movement. We start off in external rotation, coming up, going into internal rotation. Okay, let's swap this around. So coming backwards, and we're just changing the direction. And last one. So 6 rotations to one side and 6 to the other side, left and right. Really good. And so that is a knee controlled articular rotations with our PAILs and rails base in internal, external rotation. So that's a routine and a class that you would want to do every day for beginners. So give it a go.